A specific treatment tested in a randomized clinical trial happens to reduce the cumulative incidence of events by 40%. This relative reduction translates into an absolute reduction of 5.4%, given a baseline risk of 13.5%. We can now apply that treatment to a whole population, whose baseline characteristics are consistently similar to those of the reference study population. If left untreated, the individuals will distribute themselves around the event as shown. The event will occur in 13.5% of the individuals. The remaining 86.5% will be event-free. When the specific treatment is applied, the distribution of the individuals around the event will vary. Now the event is occurring in only 8.1% of the population, while 91.9% of individuals are event-free. To show what part of individuals will be reassigned from the event to the non-event group due to treatment, I'll mark this portion in green and transfer it to the non-event group, so that you can now clearly visualize what we call absolute risk reduction. This portion in green equals 5.4% of the total population and represents the proportion of patients actually saved by the treatment. Anyway, it has to be acknowledged that each and every individual of the overall population has to be treated to save this portion of patients. Also, the identity of saved individuals can never be determined. Now let's go back to the overall population and divide it into three subsets, depending on the risk level of each individual. Risk level is mostly assessed by counting and weighing the distinctive risk factors of each individual. The three subsets will account respectively for 70%, 20% and 10% of the total population. The risk of each subset can be derived by the respective cumulative incidences of events during a given time interval. If no treatment is applied, the resulting three subset cumulative incidences of events will respectively be 5%, 25%, and 50%. These are indeed the risk levels of the respective subsets. Again, let's see how individuals from the three subsets distribute themselves around the event when no treatment is applied, or when they all undergo treatment. Part of the individuals from the red bars will move to the respective blue bars. Specifically, the absolute risk reduction of the low-risk subset equals 2%. The absolute risk reduction of the intermediate risk subset equals 10%. And the absolute risk reduction of the high-risk subset equals 20%. These percentages are relative to the specific subset populations though. When related to the overall population, percentages become respectively 1.4%, 2%, and 2%. Also, the relative risk reduction is considered consistent among the three risk subsets, and equals 40%. If you only treat individuals from the high-risk subset, you will need to treat just 5 individuals to save one from the event. That is indeed the number needed to treat relative to the high-risk subset. If the green bar identifies one saved individual, the blue bar proportionally identifies 2.5 individuals, who are event-free regardless of the treatment, and the red bar 1.5 individuals, who invariably experience the event. For a total amount of 5 individuals, which accounts for the specific number needed to treat. Extending the treatment to the intermediate risk subset, the number needed to treat slightly increases to 7.5 individuals. When all individuals are treated, the number needed to treat equals 18.5. This is indeed the multiplicative inverse of 5.4%, or the absolute risk reduction of the overall population. Treating only the low-risk subset, on the other hand, is definitely unworthy, as the number needed to treat rises to 50 individuals, and the majority of salvageable people won't be saved anyway. Treating only the intermediate risk subset instead saves 1 in 10 individuals. The decision of treating only the high-risk subset will save 20% of the high-risk individuals, which corresponds to 2% of the overall population, at the expense of treating only 10% of the overall population. But it will leave out the salvageable individuals from the remaining 2 risk subsets, i.e., 3.4% of the overall population. A more convenient option might be treating both the intermediate and the high-risk subsets. This will globally save 4% of the overall population, at the expense of treating 30%, leaving out just 1.4% of the salvageable individuals. Lastly, what is the likelihood of belonging to any of the three risk subsets in case of event? Here are shown the respective likelihoods when no treatment is applied. Noticeably, the percentages do not quite differ, but, for a slightly lower value in the low-risk subset. This is due to the total number of events from the three risk subsets. For instance, even if the incidence of events in the intermediate risk subset is 25%, while it is 50% in the high-risk subset, they both convey the same value, i.e. 5%, relative to the overall population. In addition, the three likelihoods do not change when the treatment is applied. This is due to the consistency of the relative risk reduction among the three risk subsets, which reduces the event rates proportionately in each subset, regardless of the individual baseline risk.